Well, the two biggest issues I find when talking to dentists all over the country in my travels is they're all having the same issues. They can't figure out how to get a better quality and quantity of new patients into their practice who spend more than what they spent to get them. And when they do get them in the practice, they have a hard time with their case acceptance and leading or guiding people to say yes to the treatment recommendations we give them. My goal for this course is to satisfy those two things, to teach them my strategies on how they can get an unlimited supply of new patients of a better quality than what they're probably used to, as well as set the stage for more people to say yes to the treatment recommendations we're going to present them with. Well, one of the big issues I find and why we're not able to do these things is because we weren't trained that way. Right? We were trained how to take care of patients' mouths and their dental health. Nobody taught us how to run our business. Nobody taught us how to be marketers. Nobody taught us how to be psychologists, if you will.
It's marketing. I'm a dentist. I'm not a marketer. It's so hard for me to get my mind around the concepts.
It really fills a need, because even though I'm very interested in doing implant work and grafting work, if I can't sell it, if I can't get patients in the door, if I don't know how to present it, it's disappointing.
I think one of the big advantages of taking my course is that the proof is in the pudding. I'm a dentist just like you. I've had up to 4 dental practices, okay, so I know how to grow practices. I've bought practices. I've built practices from scratch. I've had associates that work for me. I've taken practices from doing $600,000 a year to doing over $6.5 million in revenue. So I know how to grow the business side of dentistry, as well as the clinical side as well. So I feel like I'm in a unique position and a unique perspective to help from both sides.
In my mind, Chris is an entrepreneur who chose to use dentistry as his platform.
Dr. Phelps is really unique in that he's not only a great clinician, but I'm not sure I've ever crossed paths with someone who's such a good clinician and yet such a genius in the area of marketing and case presentation.
And basically what I'm getting out of all this is how to make what traditionally would be an issue a non-issue, how to increase patient acceptance and to get that unscheduled treatment scheduled.
And I have over hundreds of doctors and team members that are testifying at just how powerful these things are doing in their practices. They're seeing their new patient numbers going up, they're seeing their case acceptance go up regardless of the procedure, and they're shocked at how small changes do in fact make a big difference.